Thanks, Steve. Good afternoon, everybody, and thank you for joining us again today. I'm Dr. Kara Christ, the Director of the Arizona Department of Health Services. We have had a very exciting but busy week with the launch of the state's first 24/7 vaccination site out at State Farm Stadium. We wanted to give you an update of where we were on that project, as well as some other exciting vaccination projects, and talk a little bit about the data. As always, I will provide time at the end for questions. So I'd like to take you through some of our most recent data to point out what we're seeing here at Arizona. As you can see, the cases are currently elevated. We are seeing a large increase approximately 3 to 5 days after Christmas, as well as after New Year's. The week of Christmas, we had over 58,000 cases reported, and the week after New Year's, we had 62,000 cases reported each week. So you can see that that's a significant elevation. If you look at the day-by-day epi curve, you can see that it peaks approximately the 28th and 29th of December, and then again on the 4th and 5th of January. We've overlaid on our epi curve mitigation strategies and things that can or may have an impact on COVID-19. So you can see that we've added our vaccination. When vaccination began for phase 1A, you can see some of those holidays that have played a role in increasing the spread, as well as when our mitigation measures went into effect. So things that are still red or things that are still in place are in red on the epi curve and have not changed. I also wanted to share with you our percent positivity chart. So again, this is going to look slightly different than what is on our dashboard. Our dashboard has unique individuals who have had COVID tests. This has the total tests that have been run, including those repeat tests. So if you look at the dark gray bars on the chart, those will be unique patients who are being tested for the first time. And if you look at the gray, you can see that those are repeat Arizonans who are getting a number of tests. So the percent positivity over the last few weeks has been decreasing. Again, the week that we're currently in won't be finalized until Tuesday or Wednesday of next week, because we backfill to the date that that specimen was collected. So now I'll provide some updates on COVID-19 vaccine and implementation of our program here in Arizona. One of the exciting updates that we made today, this week, that is not reflected on our chart. It will not be reflected until Tuesday. But Arizona made the decision that Arizonans 65 years of age and older are now prioritized to be vaccinated against COVID-19 in our prioritized phase 1B, along with our education and childcare services and our protective services occupations, which includes law enforcement, corrections, and fire. This recommendation was approved by the Arizona Vaccine and Antiviral Prioritization Advisory Committee, which is intended to protect those who are most at risk for severe outcomes due to COVID-19. So we know that those that are over the age of 65 have a higher likelihood of hospitalization and death. And by getting people vaccinated in several weeks from now, we hope to reduce the strain on Arizona's hospitals. You can find additional information on our website at azhealth.gov/findvaccine. And on Tuesday, we will be updating that to provide clarity about which counties are going to be vaccinated the 65 to 74-year-old age group at their vaccination sites. We also have counties that have moved into our prioritized phase 1B, and we have some that are fully in phase 1B. So if you look at the map of Arizona, the counties that are in black are still in phase 1A, so those are our healthcare providers and our long-term care facility residents and staff. When you look at our darker gray, that's the prioritized phase 1B, so that's going to be the phase that we just talked about currently. We are vaccinating age 75 and older, along with educators and child care and their support staff and our protective services occupations. When we increase to 1B, that also includes our essential workers, and so those will be people that continue to keep our society functioning. That will be people who work in the transportation industry, including gas stations, shipping, those types of things, the food industry, including agriculture. So there's a large list of employees that are eligible for the 1B category that is located on our website. But you can find out what phase each county is in. And we update this infographic daily, and you can link to it off of azhealth.gov/findvaccine. As of today, over 232,000 doses of vaccine have been administered statewide. So now we'll move into Arizona's vaccine allocation and administration. Over the next few weeks, ADHS will be working to increase access to vaccine, increase the rate of vaccination, and to streamline communications. So as you look at the vaccine distribution overview, Arizona currently follows a local allocator model for vaccine distribution. Our local partners are the backbone of the vaccine program implementation and know their counties their partners and their counties the best. So our federal partners every week provide our Arizona's allocation to the state. We divide that allocation up based on priorities to our local partners, who then will determine which providers in their local jurisdiction will receive vaccine for that week. We collect all of those orders, and then we place Arizona's full order for that week, and then the federal government will ship those orders directly to the providers that we have ordered on behalf of. As vaccine becomes more and more available, we will no longer need to use this local allocator model, and providers such as pharmacies, community health centers, and physicians' offices will be able just to directly order vaccine from the manufacturers. So this week, we received additional first dose allocations of Pfizer, which were distributed again to Maricopa and Pima counties. All 15 counties received Moderna doses. And so we continue to reserve, given the unique storage requirements for our Pfizer vaccine, we continue to reserve our Moderna vaccine for our local rural health departments. In addition to receiving those first doses of Pfizer and Moderna vaccine, we have received our second doses so that we can continue vaccinating those that have already received their first dose and have had that either 21 or 28-day waiting period. And you can see on the slide how much of each dose or how much of each manufacturer type we have received here in Arizona. So during the week of January 18th, Arizona will have been allocated 803,150 doses total. You can see how that's been allocated across the state. You can see at the bottom where we have prioritized our CDC long-term care facility partnership by providing them with the vaccine that they need to vaccinate our staff and residents at our long-term care facilities. And then you can also see the number of doses that have gone to the state of Arizona. Not all of these doses of the 803 have arrived in Arizona. A number of these doses have been allocated to, have been ordered for our county partners and will arrive next week. We anticipate that with the federal holiday, usually they arrive Monday through Wednesday. We anticipate that they will arrive Tuesday through Friday of next week. So we continue to add additional sites for vaccine administration. So we have initial phase 1A and phase 1B vaccination sites throughout the state. We have over 200 vaccination sites on our website. We also have activated the second phase of the CDC pharmacy partnership, which began the week of December 27th. So we initially prioritized in phase 1 of that partnership our skilled nursing facilities, which are our highest acuity long-term care facilities. As of the end of this week, all of those facilities will have had at least their first visit from CVS or Walgreens, and they are scheduling appointments to start assisted living facilities throughout the state next week. So as additional state vaccine becomes available, we will be adding additional providers. We've had over 730 providers onboarded with ADHS, and over 800 pharmacies statewide have enrolled in the CDC pharmacy program to provide in-store vaccinations. We have talked each week about the long-term care partnership that CDC put together with our pharmacy partners. So our pharmacy partners go into the facilities and vaccinate the staff and residents of that facility. As of this week, over 140 skilled nursing facilities are scheduled to receive vaccinations, and they will begin vaccinating our assisted living and our group homes starting next week. We've got over 2,000 facilities enrolled in the federal program. We're one of the states with the highest number of facilities enrolled. And our goal is to cover approximately 450,000 residents and staff over the next couple of months. So this is part of the infographic that we post each day on our website. If you look, you can see by county what phase that county is currently vaccinating, the total vaccines administered, along with the vaccination rate per 100,000. And so you can see statewide, 232,000 vaccines have been administered. This may not include some of the doses that are provided by our tribal or federal partners, as this is pulled out of the state's immunization registry. So to talk about updates and announcements of this week, on Monday we had a soft launch of the State Farm Stadium COVID-19 vaccination site. So far, we've administered over 20,000 vaccinations at that site, and we are averaging between 200 and 300 vaccinations per hour. We have booked tens of thousands of appointments through January 31st and anticipate opening up additional appointments that will be between February 1st and February 28th. Those appointments will open up January 19th at 9 a.m. We're very excited because our partners have really made this endeavor possible. It's a whole community partnership. And again, we just want to thank the Department of Emergency and Military Affairs, the Arizona Cardinals and State Farm Stadium, Blue Cross Blue Shield of Arizona, the Catherine and Ben Ivy Foundation, Arizona State University, and Walgreens. All of these groups are playing a large role at the site and have made this possible. We also are very excited about the launch of our second state-run vaccination site. This will be located at Phoenix Municipal Stadium. We are still looking to see how many doses we will have available for that site. So the number of appointments will depend on the available vaccine. Again, we are partnering with the Arizona Department of Emergency and Military Affairs and Arizona State University to run this site. Arizona State University currently runs a saliva-based testing site at this location, and so they will scale up to provide vaccination administration. Again, registrations for appointments are going to open up Tuesday, January 19th at 9 a.m. for this site. We updated our azhealth.gov/findvaccine website with an interactive map. You can go onto the map. It has all of the current locations with vaccine. You can select a site and a box will pop up that has information about that site and a link to their registration. So not all vaccine providers are utilizing the state's vaccine management system. Some providers are using their own appointment software, but we will link to them whenever we have that information so that it's one-stop shopping when you go to our map. We will continue to update this map with additional vaccination sites as they come. And a couple of other exciting announcements. We have been expanding access. So ADHS activated the CDC Retail Pharmacy Program. This is going to add up to 100 pharmacy stores over the next few weeks. The first pharmacies to come on board in Arizona are going to be Fry's, Safeway, and Albertsons. And so those will be included on our sites as we get notified which specific pharmacy locations will have vaccine. But they will be on our website and will be another source for those that are eligible to receive vaccine to go get vaccinated. When this program becomes fully activated, more than 800 pharmacies will have COVID-19 vaccine available in Arizona. We currently have more than 200 vaccination sites on our website that have received vaccine, and this includes 45 community health centers as well. So if you are eligible and you receive care at one of our community health centers, you can check on our website to see if they have received vaccine. And again, just an update on helping our Arizona hospitals. We have been recruiting nurses with a nursing staffing contract here in the state. That's been one of our most successful endeavors. We are very excited. The majority of the nurses are here. When they arrive, they will stay on site for 8 weeks with an opportunity to extend that. And so as of last week, 348 nurses have started work. We anticipated almost 200 more arriving this week. Again, that we don't necessarily count them until we've heard that they have arrived in the state and are attending onboarding at their assigned hospital. But we continue to work with our staffing contract to get all of the nurses that we can here in Arizona. All right, and with that, I will turn it over to any questions that you may have.
Okay, a reminder to raise your hand on Zoom to ask a question of Dr. Christ. And the first question is from Cameron at ABC 15.
Hi, Cameron.
Hi, Dr. Christ. I've got a couple of questions. I'm just going to ask them one by one and
Sure.
let you answer before I ask them one. Earlier this week, health officials with Operation Warp Speed held a press conference. I reported on this press conference. In it, not only did they urge states to open up to 65 and older, but they also said that they would be opening up a flood of vaccine to states, specifically second doses they had been holding back. Today, multiple governors across the nation have tweeted out that they have just received news confirmed directly by General Perna of Operation Warp Speed that the states will not be receiving increased vaccines from the national stockpile next week because there are no Federal Reserve doses. How does that affect your plan to expand our vaccine process here in Arizona? And what's your reaction to getting that information earlier in the week and now being hit with that information today? And have you heard directly from them about this?
So we have not been notified directly about Arizona's vaccine allocation or, potential not having the stockpile for that. We have heard the same things, other governors, talking about what they are getting notified of. My team is going to be on a call with CDC where I ask them to follow up to find out what that means for not only all states, but especially Arizona. For us, we have been planning on the doses that we get allocated each week, so it's not going to impact our plan significantly. We have been taking enough to do at least 6,000 vaccines per day at State Farm Stadium, and that's why we are holding and putting the appointments until we can see what the vaccine supply is for the State Farm Stadium. So we are being very careful. We don't want to overpromise anything, and so we are sticking to our vaccine allocation. Now, that being said, that is our limitation, is that we are not getting as much vaccine as we would like to see in Arizona. We have made federal requests to get additional vaccine so that we can continue to vaccinate. But it's one of those things that we're working with our federal partners to ensure that we can keep our current vaccination sites and add those additional sites as planned.
My second question would be regarding the 65 and older. I've had county health leaders reach out to me who said they were not notified ahead of time from state leaders when this announcement was made, and it actually caught them off guard because they receive smaller supplies than larger counties like Maricopa County. They don't have enough to expand to to 65 and older. The problem with that is, as soon as we announced it statewide, their phone lines were flooded with people, and their online sites were flooded with people disappointed that they couldn't get the vaccine at 65 and older. Do you regret how this was announced? Do you regret not having more communication with county leaders so they could prepare their populations for the inevitable news that to be able to expand to 65 and older?
So when we work with our county health departments, they are the boots on the ground, and they're the ones that are going to ultimately decide that sub-prioritization. So like we know La Paz County is still in phase 1A. They are not entering into phase 1B at this time. And other counties can stay in that sub-prioritized phase 1B. That just because we have approved for that to happen, it does not mean that the counties have to it's available for them, but if they don't have the vaccine supply, which we understand that's a significant hurdle that all of us are facing, they don't need to move into that phase or allow all of those groups until they have the vaccine available.
Is there any part of this, this news about the lack of vaccine that disappoints you? Because obviously it feels like an overpromise from the federal health officials on this one.
So, hearing that we were going to get additional vaccine was very exciting, especially with all of our plans to ramp up. However, we have been planning on the vaccine that we currently get each week and making those prioritization decisions. So luckily it doesn't impact our current plans, but it is disappointing because we would have loved to be able to ramp up and add additional appointments, even out at State Farm Stadium, had we gotten more vaccine.
Thank you very much.
Thanks, Cameron.
Next up, and I apologize if I mispronounced this, Cora Nylander.
Yeah, hello, Dr. Chris.
Hi.
I've heard from several folks, I'm down here in Pima County, that have had issues registering for appointments on the online website. Our health department here has set up a phone number that was specifically supposed to be for mostly elderly folks to be able to register for appointments over the phone if they may not have access online. But if you call that number, it was supposed to be live as of 1 p.m. yesterday. Right now it just goes to a busy tone, and countless people have reached out saying that they are having issues with that, getting very frustrated. Is there anything that your office can do to try and help mitigate those measures? So, specifically the elderly who all may not have internet or access to online means to be able to register to get their vaccines?
Yeah, I had not heard that was occurring in Pima County, so I'll have my team reach out and see what resources we can offer to assist with that. We know that there's a lot of demand for the vaccine, especially in the prioritized groups. So we would recommend, continue the phone line, and we'll see how we can help Pima County. They're great partners.
And how do you go about, you mentioned how many different pharmacy entities are going to be handling vaccinations. How do you go about allocating how many vaccine doses you can hand off to each individual pharmacy based off how many people that they get?
Yeah, so there's two mechanisms, and that's a great question. So we activated the CDC pharmacy retail program. So basically what we do is we take a proportion of the doses off the top and assign them to the CDC retail pharmacy program. CDC then will allocate those doses to the providers that they have opened up. One of the questions we're getting asked is, why is CVS and Walgreens not part of this initial 100 stores? because they are so busy vaccinating our long-term care and assisted living, they will be added in future weeks. So then, but we can also provide state doses of vaccine, things that have already been delivered to the state, but we want to get out to the pharmacy. And so then we can reallocate like 100 doses to pharmacies that have expressed interest. And so both the state and the counties have been working with different pharmacies to get them doses that have been allocated to the state as well.
And lastly here, what about folks that may be young, not elderly, but are immunocompromised, maybe of a high risk, and they really want to get this vaccine as quick as they can? When can they expect to get a dose of the vaccine?
So that's a great question. We continue to monitor the data, and I apologize, Cameron. I think there was another question that I realized I didn't answer. So the federal government this week made a recommendation that those over 65 should be included in the prioritized 1B, as well as those, or in prioritized for now, and then those that were under 65 with a medical condition that put them at risk. Given our estimates of how many people that would include, we knew that the demand would be too great for the very limited vaccine resources that we had right now. We do know that the majority of our hospitalizations and the majority of our deaths are in those that are 65 and older. So we agreed to move them in. Again, counties are able to make the decision based on their specific vaccine doses and their specific plans, whether or not they have the vaccine to accommodate that. We will continue to see when we can bring in that next group based on vaccine allocation and resources.
Thanks so much, I appreciate it.
Thanks.
Next up is Bud Foster.
Hi, Bud. I can't hear you.
Bud is in the process of unmuting.
Oh, okay, good.
We'll see.
Unmuted. I'm sorry. Hello, Dr. Chris. Thank you very much for doing this. A couple of questions. Obviously, demand far outpaces supply right now. Pima County, when they opened their line yesterday, had 20,000 appointments in the first couple of hours. So there's a huge demand for this. Everyone has been talking about ramping up, giving the public a lot of confidence that the ability to get a vaccine is out there and will be coming fairly soon. Because of the news from the federal government that they have not been setting aside that second dose, are those plans to ramp up now being put on hold? I think the folks at home would really like to know an answer to that.
So that's one of the things that we have to find out information for. So what they're saying is they put aside those initial weekly allocations, the second dose for 3 weeks later. What we've heard through the grapevine is that they don't have the stockpiles for that second dose ongoing, but that they believe that the manufacturing supply will be able to keep up with both first doses and second doses. We're going to get more clarification on that hopefully this afternoon. So I don't have a great answer for you, but we will be working within our allocations to ensure that we are getting as many first doses as we can out, but also ensuring that people have access to those second doses.
Also, the CDC released a study today on, I don't know how to say this, B117, which is a variant, which they said is very highly transmissible and is now appearing in the United States. And they said that they would have to ramp up vaccination and likely testing as well because of this variant, and said it could be the most active variant come March. Is this something that you have discussed? Is this something that is on your radar at this point?
So we are on the lookout for variant coronaviruses, and yeah, we had heard that they were starting to see a number of cases of this specific variant. I think that making sure that we have adequate testing and resources, and then trying to get as many Arizonans vaccinated. We are watching to see what those variants cause. It does look like at this time it causes increased transmissibility. It does not appear to be impacted by it does not appear to impact the vaccine's effectiveness, but we know that viruses mutate all the time, and so it's always something that we're watching out for. And we have a great partnership with TGen and our universities to do sequencing. to potentially identify if we see variants in Arizona.
And one final thing, it appears that hospitalizations have leveled off now, at least somewhat. We're a couple of weeks away from January 1st holiday, 3 weeks away from Christmas. Are we seeing a leveling off of the hospitalizations, and might that have an effect on deaths down the road?
So yeah, so we've seen a little bit of a leveling off over the past couple of days. It's promising, but we think it's a little bit early to consider that the ongoing trend. We know that hospitalizations tend to follow the cases by about 2 weeks. So, this would be about the time that we would start seeing hospitalizations from that peak back on the 3rd, 4th, and 5th. So we're going to continue to monitor very closely and watch with our hospitals. But, the decreasing percent positivity is promising. The leveling off of that is promising. We're seeing a couple of counties that are starting to see a downward trend in their cases. So all of that is promising, but, it's very hard to predict if that's the path that's going to happen or if it's going to, go back up. So we'll keep posting the data so that everyone can see it and follow along with us.
Are you optimistic?
I'm hoping to be optimistic. I think, as we continue to get more and more people vaccinated, we won't see the immediate effects of a vaccination. But with all of our residents in our long-term care facilities, now maybe getting closer to their second dose, hopefully that will reduce the need for some of those residents, those high acuity people, to be transferred to the hospital. So there are some promising things coming up in the next couple of weeks.
All right, thank you very much. I really appreciate it.
Thanks,
Next
Bud.
up is Josh Sanders.
Hi, Josh.
Hi, Dr. Chris. Happy Friday.
Happy Friday.
I want to circle back to what we're hearing from General Perna of Operation Warp Speed. He did confirm with Governor Kate Brown of Oregon that states will not be receiving increased shipments of the vaccine from the national stockpile next week because there is no Federal Reserve of the doses. We obviously have an issue here in Arizona when it comes to the demand being greater than the supply. You said that, Governor Ducey has said that. How does this impact, though, us again going forward next week, especially when we're going to be opening up potentially more appointments, but we may not have the vaccine? And then I have a couple more questions.
Yeah, so yes, we do have more demand than supply, which in a public health standpoint, I want 100% of people vaccinated. So I am so excited that there is this much demand because we weren't sure what we were going to get, how many people would want to get the vaccine. So we continue, what we've been told is that we can anticipate getting the levels of doses like that we are getting right now. As long as we continue to maintain those levels, we should be able to continue providing, the 24/7 at State Farm, at our Phoenix municipal site, and continue to get it out to the community and to the public. So there's several things that are in play. We've got that federal partnership that we're pulling doses off for our long-term care facilities. That takes a certain amount of doses up front before they do it, but it's not an ongoing need. So once they get all the doses that they need, those will then be added back into Arizona's total allocation. And we continue to work with our county partners to make sure that if they've got pod sites that they're planning or they've got events, to try and get them the vaccine that they need. We have not been basing our planning efforts on projections. And so really trying to stay within our means here so that everyone who has an appointment has a vaccine waiting for them. But it's difficult. I mean, we were hoping to see increased, numbers of doses. They are anticipating increased manufacturing, so, continuing them to ramp up the manufacturing so more and more will come off. They do anticipate hundreds of millions of doses available by March or April. So I think all of that is promising, but, we just go by our weekly allocation here in Arizona.
Right. Can we talk about the relationship between ADHS and the counties? Maricopa County, yesterday, Dr. Sunstein said that they will not be vaccinating those 65 to 74 until the state receives more of the vaccine. And I know from listening to that press conference, it was clear that Maricopa County and the state are not on the same page. And the county, which represents 4 million of our 7 million Arizonans, what can you do to get on the same page with Dr. Sonnenschein and those folks? And then my second question, or a follow-up to that, is with the announcement of the Phoenix Municipal Stadium, we're being told that it is not a 24/7 distribution site. So if you could provide some clarification on that as well.
Yeah, absolutely. So we work very closely with our county partners. We make the recommendations from a statewide perspective, but the counties are the local experts on the ground, and we know that they have the ability to sub-prioritize below that, and they have the opportunity to do that. We are just opening up the eligibility if there are counties that wanted to prioritize those that are 65 and older. The federal government released those recommendations, and we are just trying to make sure that Arizonans have access, especially if they are high priority. But we completely understand, because the entire state is dealing with local vaccine availability, and that we just don't have enough to meet the demand for what we want to do. So we are looking at where vaccine is not being utilized as efficiently, bringing it to places that are using it more efficiently, so that we can make sure that as many Arizonans are getting vaccinated as possible, and that vaccine is not just sitting in freezers not being used. So we continue to look at that. And then the other question was the Phoenix Municipal Stadium. So initially, we didn't know what type of response we would get for a 24/7 site. We didn't know if people would want to be up at 3 a.m. getting their vaccine, but we were pleasantly surprised that all of our appointments through January booked. And so that includes our, 10 to 4 a.m. slots. Looking at the vaccine availability and making decisions about the priority. We do have a 24/7 spot in Arizona at State Farm Stadium. People are welcome to register for those spots in the middle of the night, especially if it's more convenient for them. But seeing that we had limited vaccine available, we wanted to make the most effective use of our sites. And so we decided that initially Phoenix Municipal Stadium would start as a just daytime operation. And so we will continue to evaluate that. If we get more vaccine and we have the ability to expand that site 24/7, we will be doing that, because we built State Farm Stadium to be a site that can be replicated in other areas. And so we're looking at where we can deploy that as well moving forward.
I wanted to ask, or I'm asking about the rate of distribution, because right now, if you look at the numbers that you just gave us, 39% of those doses we have been gone into somebody's arm.
Yeah.
So are we with the vaccine, with the doses that we have, are we vaccinating fast enough? Because at this rate, it's going to take a very long time before we get anywhere close to herd immunity, and that is something that the governor has kind of stood on as this is going to be the end all, the fix all of it, which it's not. But the facts speak to that, the science speaks to that. But what about the rate of distribution here in the state?
So as you know, we were not happy with the rate of distribution, which is one of the reasons that we stood up the 24/7 site. We are looking at increasing distribution. Pima County has a plan to extend hours at their sites, add additional sites. Maricopa County has extended some of their pods to continue vaccinating. And so we continue to look at how we do that, but I think over the last week, we've significantly ramped up administration of the vaccine, and we will continue to do that. We were excited yesterday because our goal at State Farm for this week, based on the number of doses we have, has been 6,000 doses per day. And yesterday, in a 24-hour period, we had over 7,100 doses administered. So we were very excited. We know that we can do more if we get more vaccine and continue to increase that administration, because like you said, we want to be making sure that those vaccinations are going into arms.
Absolutely, and that should be celebrated. My last question just centers around our most vulnerable when it comes to those older folks, 65 and older, 75 and older. I had a number of conversations yesterday with people just so frustrated not being able to either get an appointment and register, those 75 and older, because they can't navigate the computer, or being on a phone call. 211 will direct them to just say, hey, we don't have an appointment. Call the number for ADHS. And I called it myself. I was on hold for over an hour before I had to hang up. And just talking to these older folks that are so frustrated, they may not even have somebody that can drive them to Glendale. What are we going to do for them? How are we going to fix that?
So those opportunities are going to continue to increase. We know that State Farm Stadium, I've been out there every day. For me, I live in the East Valley, so it's quite a distance to drive. So we completely understand. What we're trying to do is get more also into the community so that, people can go to their local pharmacy, they can go to their local community health center. Eventually, they'll be able to go to their healthcare providers just like they would for their flu shot. And so that is our overall goal, is to get it as prevalent as just trying to find your influenza shot. It's going to take a while given the limited resources for that. So what we would recommend, and we know that it is difficult to get an appointment. We are continuing to make improvements to our website so that it is easier to use. One of the things that is available is if you've got somebody that's tech savvy and you don't have internet access, or you don't have, or you're just uncomfortable using that for registration, somebody else can register for you. You can get them started and just have them pick the appointment. That's not going to help right now because we are out of appointments, but more will open up on January 19th. And we're always looking to see if we can add more capacity with the vaccine. 211, what we're doing, we have partnered with them to answer the calls. We have heard that there have been a huge number of calls, even more than we anticipated. And so what we're doing is we are getting another contract with a call center. We're working with the Department of Administration to really ramp up and increase that call center so that we have additional people to answer the phone and help get those appointments.
Thank you, Dr. Chris.
Thank you.
Okay, and just a note that Dr. Chris, we appreciate the questions. Dr. Chris' time is a little limited today, so if we're going to get through everyone, if there's a chance you can tighten up the questions, I'd appreciate it. Matt Galka.
Hi, Matt.
Hey, I feel like that was specifically geared toward me, so I don't ask you too many questions.
No. You're good. You're
No,
good.
I'm kidding. All right, so my first one, I have a couple ones, and my first one might be the same.
Oh, sorry, Matt.
Uh-oh.
My bad.
Hold on, Matt.
You got me now?
You're back, sorry.
Yeah, you're back.
Okay, great. My first one might be the simplest one, just because I don't know what to tell people when they ask me. But for folks who made an appointment for the initial dose at State Farm, they're wondering when they make their second or when they get their next one. Does the state reach out to them? Do they do it right there on site? Can you explain that?
Yeah, absolutely. So what we're going to be doing, if you received your first dose at State Farm Stadium, we have you in our system. Look for an email from the department, from the same email that sent your confirmation and your registration. We are inviting those individuals to register for an appointment. We are holding blocks of appointments for those second doses. Those should be coming within the next day or two to register for that. And so look for that. And then we will be opening up on February 1st for first doses again. So you don't need to go back in to try and fight for an appointment. We are holding blocks of appointments for everyone who has already received a vaccine.
All right, my next one is, I asked you earlier this week a hypothetical question, and anecdotally, this is what we're hearing. We've gotten a few callers. Somebody will go to the vaccine site, they happen to be in a car with somebody who they don't have an appointment, but the other person does, but they're getting a shot also. What does this do for supply, and how strict are we being about enforcing the 1A and the 1B? Or if we're not being strict, is the goal just to get as many shots out there as possible? but we're just not saying that. What have you heard?
Well, I think our overall goal is to get as many shots out there as possible. But what you're specifically talking about is people who are in a car with somebody who has an appointment who also gets a vaccine. And that's a decision that's made case by case by our clinical team. So if we've got the vaccine that's available and we've had a number of no-shows, they can make a decision on if somebody in the car who is with somebody who had an appointment, so is eligible, can receive that vaccine. And the things that go into that are, is this an individual of a care, are they a caretaker of the people in the car? If they are, and those people are over 75, the clinical staff may make a judgment call to vaccinate that person because that person still could put the other individuals at risk. Other things would be if they had an appointment but they weren't registered that day, they may do the vaccine at the same time if we have the staff and the vaccine available so that those individuals can come back on the same day versus having to come to State Farm Stadium 4 times instead of 2. So they're making those clinical judgments on a case-by-case basis to make sure that we're getting as many vaccines, that none are being wasted, and that we're trying to be as customer service friendly as possible.
Great, and my last one, I know other people have brought this up, I'm gonna bring it up one more time.
Yeah.
The disconnect there seems to be between the state and the county. You addressed some of the issues, you're gonna contract with another phone vendor because, we have heard that people can't get through. But this is what I'm sure all of the reporters on this call are hearing to a varying degree. And that's, there are elderly people who are calling us, some of them in tears. I live in Maricopa County. The county says 75 and older. The state says 65 and older. I don't know what website I went to. I don't know this, I don't know that. They just want to get their vaccine.
Right.
Would you agree that at least at the beginning of this rollout for our older population, it was not user-friendly? Maybe we had just rushed it a little bit.
So we have been trying to make sure that we have everything in place to try to accommodate the large numbers of people that are wanting to be vaccinated. We continually are improving. So was it Matt? Was it his recommendation?
Yeah.
Oh, so your recommendation coming back to us, because all of us agreed, why can't it just show, why do you have to go onto a day to see if there's available appointments? Why can't it just show that next available appointment? We thought that was a great idea, so we are implementing that to make it more user-friendly. We've been working with Google on making this product better. They're the initial developers of it. So yes, it has been a work in progress. We continue to improve. We do know that our counties really have the authority to make those decisions in their local jurisdictions for their communities. The governor was very emphatic that he wanted those over the age of 65 to be eligible and to be available when those counties were ready to vaccinate those individuals.
Thank you.
Okay, Ricky Vasquez, I'm unmuting you.
Hi, Ricky.
Hello. So still on the topic of registration, we've been getting a lot of calls from people that say, I'll drive anywhere in the state to get my vaccine. Pima County has their own registration, Maricopa, there's the state one. Are there any hurdles with people that are trying to just look for the next available and drive across the state to get it? And is there, will there be any issues with people doing, say, like a double registration, registering Pima County and Santa Cruz County to see which one sticks first?
So yeah, that definitely could happen. There's not one system that is going in, because if you figure when you're working with pharmacies and healthcare providers and community health centers, all of them are going to have their own appointment making software. So we provided the vaccine management system as a free tool that providers could use if they wanted to do it. It automatically reports and uploads the data to our immunization registry, which is great, but it's not a requirement to use. So yes, people may be able to go in and identify different appointments that may be available and make those appointments. What we would recommend, like our pods, You really need to look at what the requirements are for each individual location. We do have the registration link for those locations that are on our maps. But look at the requirements. At our pods, we would take anybody from any county if they're able to get an appointment.
And have you heard from any of the smaller counties of people coming from neighboring counties and using up more of their utilization than they were planning?
You know, we have not heard specifically about that county to county. I know that there are always concerns that because we allocate on a pro population basis or a pro rata basis, that may you know, if somebody lives closer to one county but they live in another, they may go over there. One of the concerns that we have heard, though, is that some of our bordering communities from other states, if they hear that there's a clinic in some of our border states, like along California, that some of those residents might come over. And so they've been planning how do they get that out to be more prioritized for Arizonans. The one thing that we would caution about that is the virus doesn't know what your state of residency is. And if you're in Arizona, whether or not you're an Arizonan, you're just as likely and at risk to get COVID-19 and to potentially have bad outcomes. And they will utilize an Arizona bed. So that's what we're trying to prevent and trying to make sure is that no one in Arizona gets COVID-19. We would like to see that end. But if they are here, they will be using Arizona resources. And so we just want to make sure that everyone's protected so that we can protect Arizonans.
Great, that's all I have. Thank you, Dr. Chris.
Thank you.
Next up is Katie Davis-Young.
Hi, Katie.
Hi there. I just wanted to clarify, Maricopa County says it's not opening up to the 65 plus group next week, but the State Farm and Phoenix Municipal Stadium, those new appointments coming online next week will be available to that age group?
Yes, so Maricopa County has 5 pods that they're partnering with some of our health systems to operate. All of the different sites have their, like, if you use the Arizona vaccine management sites, we have like requirements that you have to check, like, yes, I'm a healthcare worker, or no, so that we can screen to make sure that you fit one of the priorities. We will be opening ours up to age 65, but Maricopa County will be keeping theirs at 75 and above, given the vaccine doses that have been allocated to those specific pods. They just don't have the resources to be able to increase that age just yet.
Okay, and really quickly, can you talk about where the budget and staffing for the new Phoenix Municipal site is coming from?
Yeah, absolutely. So we received last week's an announcement that Arizona is going to be receiving $65 million. That's from that new package that was passed like a week or two ago. The time just all blurs together right now. But Arizona is getting $65 million specifically for vaccination efforts. And so that is going to pay for some of those big state-run pods. It's also going to provide funding to our county partners so that they can do their vaccination efforts. It's also going to go into things like a campaign to promote vaccine interest and to encourage people to get vaccinated. So there's a lot of activities that will come out of that, but that's where that funding is coming from. The staffing is coming from, we have contracts with ASU to provide the staffing and the resources and the logistics for those sites. We have that for State Farm. We're still working with ASU on what the Phoenix Municipal Stadium site will look like when it stands up on February 1st. We also are partnering with Blue Cross Blue Shield out at State Farm Stadium, who is arranging the volunteer efforts out at State Farm. And so we'll be working with entities to do that same thing. Some of it will be volunteers, some of it will be paid staffing. Oh, and I'm sorry, I forgot a huge partner. The Ben and Catherine Ivy Foundation gave us, donated $1 million to the department to help us with the staffing costs for the 24/7 site. So that's another resource that we were so lucky to get from our partners.
Next up is Mike Pelton. I'm unmuting him.
Hi, Mike.
Hi, Dr. Chris. How are you?
I'm good today. How are you?
I'm good. 2 questions. I know time is of the essence here, both on current conditions in the state.
Yeah.
On mitigation, the state has not dialed up or implemented new measures, but according to the ADHS COVID dashboard, since last month, there's been, I think, 3 weeks and counting of more than 700 COVID deaths each week. So my question is, if 700 plus COVID deaths a week does not warrant new mitigation strategies, is there literally any scenario at this point that you would recommend or the state would impose new or more stringent measures?
So that's a really great question. I think one of the issues is, as we look around, a lot of the other states are experiencing the same thing. And when you look at the mitigation measures that have been put into place, my colleagues in California have, areas of California pretty locked down. That does not appear to be working in California. Florida doesn't have a lot of mitigation strategies in place. And so, all of the states are experiencing these same types of rises. Really what we need to do is to really enforce the mitigation strategies, because we have some significant mitigation strategies in place in Arizona. It's the enforcement that is really important to make sure that they're following the occupancy limits, the mask requirements. I know my team is out, and we go out on evenings and weekends to enforce some of those, enforce the requirements. But there's a lot of establishments that are there, and so, it's really more about enforcing the current mitigation measures, because we know that they worked. And then really getting the message out about those small household gatherings. If you look at the data on like a day-by-day basis, if you look at our epi curve, the spikes on December 28th and 29th, so exactly 3 to 5 days after Christmas, and if you look at the spikes on January 4th, 5th, and 6th, they're very large. Most people are going to develop symptoms 3 to 5 days after their exposure to COVID. And so, we know that people got together during those holidays, and we're seeing that in the data. And what we would really encourage people is, you can't let your guard down. Even when you're with people that you love, you have to wear your mask, you have to stay physically distanced, and we know that it's extremely difficult to do that.
Next up is Max Gordon.
Oh, okay. Hi.
Hey there. So what do you have to say to people who might be 75 or older, but haven't been able to schedule an appointment and are frustrated that the threshold has been lowered to 65 and older?
What we would say is keep working at getting that appointment. We will be opening up additional appointments. We know that when we looked at those that are 65 years of age and older, we know that that there is all of them are at a higher risk for hospitalization and death, and we knew that it would add approximately 750,000 Arizonans. We will continue to try to increase availability, but we do want to make sure that everyone who's at risk has access to the vaccine if it's possible. And we know that it's very frustrating, especially when the resources are so limited. We have been putting in multiple requests to our federal partners. I was on the phone with CDC yesterday saying, if there's states that don't want Pfizer, if there is states that aren't taking Pfizer and it's left, Arizona will take it. We have capacity now to increase the number of, appointments, the number of shots we're given. State Farm Stadium actually has the ability, while we're saying our goal right now is 6,000, that's because that's the resource limitation that we have with our vaccine. We can easily expand to 12,000 a day. And so if we could get more vaccine, we would be able to even ramp up our administration more. So we continue to work on that front, but just to keep trying to get an appointment and to look at our website, because some pharmacies will have vaccine as early as next week, and they will have a number of doses that may not have as many people going for them given their geographical location.
Okay, next up is Haley.
Hi.
Hi there, Dr. Chris. So I just wanted to ask one question.
Yeah.
So the Arizona Department of Health Services has administered over 2,000 vaccinations per 100,000 people, as we know. According to the CDC's website, and as of this morning, Arizona is ranked 45th in the nation on a per capita basis for vaccine administration. So despite recent announcements, I just was wondering if you could give an answer on why that may be.
CDC says we've done 150K.
Oh, okay, so CDC sounds like they're a little bit behind in the data, so they're pulling data, and they're only updating a couple of times a week. We would recommend going by our numbers on the website. Ours are gonna be closer to the real numbers. We know that we have a 24-hour reporting delay, and we know that if a site has dropped to paper, it may even be a little bit longer before they get that record into ACES, which is where we're pulling our data from. And so we even know, like, if you go look at it on Tuesday, it's going to be 5 days behind because they're not going to update on the federal holiday, and they update Monday, Wednesdays, and Fridays. So we would recommend using our site. One of the ones that we've been looking at is the Bloomberg Tracker. They update on a daily basis as well. Sometimes they're a little bit behind our numbers, but they're pretty good about updating. And that shows, I think, today that we were 17th or 18th in the nation for the number of doses administered.
Okay, next up.
Okay, thank you for your time.
Thank you.
Allison Steinbach.
Hi, Allison.
Thank you so much for doing this. I appreciate it. So I have a couple questions, and I will try to ask them all at once, if that's okay to save time.
Okay, I might forget. Just remind me if I look blank.
So the first is that Biden said he wants to administer 100 million doses in his first 100 days. So I'm curious what impact you think those goals will have here in Arizona. So how would that sort of take place? Do you expect any more funds or staff from the federal level?
So we've heard that there's a potential, another bill that Biden would propose to provide more funding and more vaccine to states. We're very excited if that's going to occur because we'll always be able to use additional funding and additional resources. We would be probably looking at administering 2%. Arizona's population is about 2% of the United States population, and so looking to get 2 million doses administered in 100 days, I would imagine. We always try to rise to the challenge, and so we'll continue to increase our vaccination to help him meet his goal.
And then my second question is in terms of homebound people. I saw that in Seattle, for example, the fire department is going door to door to sort of vaccinate those people who can't leave their home easily. I'm wondering if there will be any similar programs here.
So we're working with our local counties to identify their strategies. So we know that we've got some pharmacies that have more mobile pharmacy ability, and so working with them to get some of those homebound individuals, as well as, our fire departments have been community vaccinators for a long time. And so the counties may deploy those types of situations differently depending on the resources and the available the available vaccinators in their community.
Thanks so much.
Thank you.
Okay, next up is Martha.
Hi, Martha. Oh.
There you go.
Can you hear me now?
Yeah, we can hear you now. Yeah.
Much. Dr. Chris, if you have not yet heard directly from federal officials that additional doses were not being released, how can you be certain that your regular allocation for here in Arizona won't be cut?
So we had heard that we were going to be getting a number of increased doses. We weren't actually given a number, but we were told to expect increased vaccine. What we have been told is that the current numbers, the baseline that we're getting right now, can be expected because that's the normal manufacturing rate that they're at right now. We can't guarantee that we won't get decreased vaccine coming up in several weeks, but we plan accordingly based on our allocations that we get. So we'll continue to monitor and adjust our appointments at State Farm to make sure that we have the available resources that we need as we get those doses.
And speaking of planning, does municipal stadium planning take into account that there perhaps may not be extra doses that will be released? And so how many appointments will then be available at that site when you start making them in just 4 days?
So that's what we're looking at right now. We'll be working over the weekend to determine what that potential allocation could be. We will likely start with fewer appointments and then potentially add more appointments if we identify that we have additional resources. But that is one thing that we're waiting on, is just to identify how many appointments we can get, because we don't know what the overall vaccine supply is.
Finally, can you just update us on the prisons in Arizona? Have they been receiving vaccines? Where are we at with the number of prisons and vaccines available to them?
So we are working with our correctional partners to get currently we are in prioritized phase 1B. So our protective services occupations, which includes correctional officers. I believe ADOA was working with one of the prison facilities today to vaccinate the correctional officers out there, and then any inmates that may qualify based on like high risk and stuff will be assessed in our later phase 1B. And so we have been working to ensure that they've got the vaccine allocation that they need in order to do that. And we're still onboarding additional prisons so that they can get the vaccine and have it administered.
Thank you for your time.
Thank you.
Adonis Albright.
Hi.
Hi, Doctor. Happy Friday.
Happy Friday.
Yeah, so my question is kind of similar. It's about the vaccination sites, the 24/7 sites. I've had some concerns that have been raised to me about the allocation for these sites and how it's going to affect distribution to other counties moving forward. Essentially, if they're all going to start to be funneled to these 24/7 sites. So my question is, how is the allocation working for these sites specifically? Is it just based off the allocation that Maricopa County is getting, or how are you guys handling that?
So what we're looking at, we are only using the Pfizer vaccine at our at State Farm Stadium and also for the Phoenix Municipal Stadium. And so the one nice thing about us using the Pfizer vaccine, because it has such stringent requirements for freezers and thawing and the time that it can be out, it can't see the sunlight for very long. Our rural counties actually asked not to get the Pfizer vaccine, so that saves the Moderna vaccine for our rural counties. We are not using Moderna at either of those sites. And so we're working with Maricopa County to ensure that their sites, and Pima County, to ensure that their sites that are utilizing Pfizer have the doses that they need in order to vaccinate their current, their appointments that have already been made, and anything additional that they want to do moving forward. And then we look at the remaining Pfizer allocation to see what we can do at State Farm Stadium and at the Phoenix Municipal Stadium.
All right, copy that. Thank you.
Thank you.
Okay, next up is Patty in Tucson.
Hi, Patty.
Thank you for Hi there. Thank you for your time this afternoon. I'm also curious about what's coming into the counties, and I wondered, now that the counties have launched their rollouts, will you revisit having statewide sites so that more of that vaccine can get to the counties? Seems more prudent.
Yeah, so one of the things, we did get a little bit of increased Moderna this week, so we were able to give increased allocations to our counties. Pima County got more vaccine this week. And we're ensuring that they're getting the doses for their second doses as well. So we're working with Pima County on their plan to increase the number of sites and to increase the time that they are open and to give them the vaccine for them to be able to do their stated goals. So we're working with each county individually to make sure that they've got the vaccine that they need, and that that we're saving that very precious Moderna resource for the counties that have it, but we also do provide Maricopa County and Pima County with the Moderna vaccine as well. So we're really trying to make sure that the State Farm Stadium does not impact ongoing or planned operations.
Okay. Pima County was included in that on the Moderna, that they just wanted Moderna and not the Pfizer, or those
No.
more rural counties?
Yeah, so the rural counties were no, that's okay. So the rural counties, the 13 rural counties, not including Maricopa and Pima, asked not to get Pfizer. Maricopa and Pima get both Pfizer and Moderna.
Okay, thank you.
Okay, and Director, I cut off Mike Pelton. He had a follow-up, so this is our last question.
We're sorry.
Oh, hey, you got me, Dr. Chris?
Yeah.
And that might have been my fault. I think I got locked out. Might have been my fault for asking the second question.
Oh, I'm sorry.
I'm sure, for people who watch us every day, I think that there's a little bit of a disconnect, so I'm hoping you can clear this up. So
Yeah.
I assume you're aware that this week, top doctors at 5 hospital systems held a joint press conference, essentially saying their facilities are overwhelmed and urging additional mitigation efforts. So why is the state not listening to those doctors or doing any of the measures that these hospital systems are out there calling for, like a statewide mask mandate, closing indoor dining and the like?
So we're working very closely with our hospital partners to see what types of resources they need, provide technical assistance, make sure that they have the PPE and provide some of that additional staffing. So we have been working on that with them. I think while we understand that the hospitals are in the midst of a surge, and we are working through the Arizona Surge Line to make sure that we are transferring patients as needed and coming up with ideas to help get people who don't need to be in a healthcare or a hospital any longer into another type of setting, as well as looking at potentially bringing patients who maybe are lower acuity to other hospitals that may have capacity for lower acuity patients, but not those higher acuity patients. So we're brainstorming with our hospitals. One of the things that the hospitals don't really need to take into account is those long-term public health community impacts. So the impacts of what happens when somebody loses their job and can't get food, can't get housing, the mental health issues of that. And so we're trying to balance that from a public health perspective and make policy decisions that we believe will have an overall impact on the coronavirus transmission. And so we're working very closely. I meet with our hospitals every week. I meet with their intergovernmental relations people every other week. We are working with the governor's office to develop and establish policies that will be best for Arizonans.
Okay, everyone.
All
Thank you
right.
for joining us today. Thank you, Dr. Chris.
Thank you.
And everyone have a safe and great weekend.
Yeah, have a wonderful weekend. Thank you.